Okay, so we're going to go over the essentials or basics of a nursing neurological assessment. And this is, of course, a lot of it's incorporated into every assessment that we do. As soon as we're greeting the patient and talking to them, we're assessing their level of consciousness, any sort of obvious confusion or deficits we can usually tell pretty much right away, but we're just kind of going to talk about it as its own focused assessment. So just like with anything, we're coming in doing a safety check or a general survey, looking at our patient, and we're going to start talking to them. So hi Justin, my name's Aaliyah, I'll be your nurse today. How are you?
I'm well, thank you.
Good. So you want to make sure that the response makes sense. Do you know where you are today?
I'm at the University of Manitoba.
Good. And then you'd want to ask them if they knew the date and the year and so on. The date, even just the month would be good enough, or the season for some people, depending on the situation. But you'd want to kind of assess their level of consciousness and any confusion and their orientation. And so I would also ask my patient at this time probably if they're having any headaches or dizziness, any numbness or tingling anywhere, areas of weakness, those kinds of things, because they may help us hone in a little bit our assessment or focus our assessment a little more. Those are not bad questions to sort of start asking. But we can kind of ask those questions, have that conversation, and then sort of jump into our neurological assessment. So starting with inspection always, and we've talked about looking at the patient, their alertness, level of consciousness, confusion, ability to answer our questions. Make sure that they can hear you. If they do need hearing aids, that may be affecting their answers, of course. So when Justin was talking to me, it's not a bad idea to look at their face and make sure that their face is moving symmetrically. But you could also ask the person, can you just smile for me really big? Good. And so you want to see that they have symmetrical facial movements and no one-sided facial droop. And we can move into, again with the face, we can check their pupillary response. So you're going to want a pen light for this. And you could darken the room too, if you can. But we're going to check your pupils. So if you could look straight ahead at the wall, that's great. And you always want to come from the side and just shine it right directly into their pupil. And you want to watch that pupil constrict. And you want to note roughly how much it constricts and how quickly it constricts. And while you're watching the one that you're shining the light in, you also should be simultaneously watching the other one for a consensual pupillary light reflex. So they actually should both constrict simultaneously, even though you're only shining a light in one. And so you want to do that twice. So you want to note if his pupils are equal and round and reactive to light, and how much they reacted. So Justin's reacted to about 2 millimeters. Some pen lights hopefully have that listed on them, sort of an approximate measurement of the pupils. You'd also want to note the speed at which they reacted. So were they brisk, were they sluggish, or were they fixed, as in not reacting at all? And you just through practice get a sense of what brisk is. It's sort of that would be about brisk. So you want to know the size again and the speed at which they reacted. The other test that you can sometimes do, and it's often noted, is accommodation. So PERLA has that A at the end, accommodation. And accommodation is done when appropriate or when you're able. You can ask the patient to look at, say, your finger, for example, something about a foot away from their face. And now look at the wall behind me. And you should be able to see their pupils dilate and constrict with the convergence and divergence of focusing on something further away, just like a camera. But PERLA isn't, the A in the accommodation isn't necessarily tested if the person is obtunded or has a decreased level of consciousness, right? Because you wouldn't be able to get them to follow those instructions. So that's the pupillary aspect of the exam. I'm going to move on to just a crude strength test. So Here we're going to assess his strength bilaterally in his limbs. This is also going to help us determine if he's able to follow instructions, as well as let us know if there's any sort of one-sided deficits. So a good way to start is, can you squeeze my fingers, please? As hard as you can. Good. And strong, he's strong equal bilaterally. I'll get you to turn your palms like this. Pull up towards your chest like a bicep curl, and I'm going to try to resist you. So we can kind of see, you can kind of get a sense of how strong each side is. And same idea, push down on my hands. I'm going to try to resist. Good. And if you could just hold your hands out in front of you. Good. And you can, I'm going to push down again. Good. And you push down on my hands. Good. So he's strong and equal bilaterally. Similar thing with the legs. Depending if he was laying down, we could do this a little bit differently. But if you can push towards me, good, and pull back towards you, I'm going to try to resist again, good, and strong bilaterally. And with your feet, if you can pull up towards your shins, good, and push down like petals on my hands, perfect. So we're just doing again a crude test of strength bilaterally. You can go into a lot more detail with that strength testing and with flexion and extension angles. And we can do that for practice. That's not a bad idea. But just sort of that essential neuro exam, those were sort of the components of it. Also, a little bit more advanced or specific practice, you could use a reflex hammer and test the person's various reflexes. And you can do that. That's more of practiced in specialty areas by nursing, but so it's not the typical part of a basic nursing neurological assessment, but just so you know, you may see that or want to practice that, and that's fine. So those are sort of the basics of a neurological assessment, and we'll go into the Glasgow Coma Scale right away, as it's commonly used. It's not always the most objective measure, but it is probably the most commonly used scale right now. So we will go over sort of the findings or the different findings of it.